What's going on, everyone? Happy Saturday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, January 6th, 2024. We're still going to go with the name of Pandemic Update today, but I want to share some personal news. If you have been following my channel for a while, you may be in the loop. If you have not been following my channel, maybe you're new to my channel. Well, first off, subscribe to my channel down below and give these videos a thumbs up if you like what you see. Today we're going to start off with some personal news, and yes, we are going to do a little bit of pandemic news as well, because that is ever so important with some new data that just came in last night. So first off, let's start you back to, say Tuesday. So remember, back on Tuesday, I had to go to a GI specialist. I was already not feeling myself that morning for some reason, but the GI specialist visit was for a completely different reason. It was because of a swallowing issue that I'm having. When I swallow things and it gets stuck in my throat sometimes, and every once in a while my stomach gets a little upset. Well, anywho, it just so happened the stomach upset issue occurred that day, or so I thought. This is back on Tuesday now. So I thought occurred that day. Turned out that wasn't my stomach issue, and I actually had a stomach bug or some type of a GI bug. Well, this continued on Tuesday evening. It delved into, you guessed it, yes, the bathroom, running to the bathroom. And then it kind of got better Wednesday morning, but I was kind of tired, had the chills a little bit. Wednesday was a little bit better, and by Wednesday evening, I was fine. Then comes Thursday. I was fine. You saw the updates. Fine. Thursday night, my coughing, which is a normal thing for me, was a little bit worse than normal and hurting my chest a little bit. Maybe a tiny bit of shortness of breath. Yesterday I came on, did the update, told you all I was fine. Along came last night. We'll go to about 8:30 last night. Coughing came back again, and it was bad. And then my chest started hurting. Then my O2 saturation. Yes, I can actually check my O2 saturation with this O2 meter right here, blood pulse oximeter. And at one point it got down to 88, which is concerning. Then it went back into the 90s, and like, okay, do I go to ER? Do I not go to the ER? I'm thinking, nah, I'm just going to hold off and wait. I already had it in my mind that evening that I was going to go to the urgent care and try and get an RSV test. Let me backtrack for a second, because I forgot to mention something. 3 days in a row, Wednesday, Thursday, and yesterday being Friday, I took COVID tests. These rapid at-home COVID tests. All three of them negative for COVID. And you're hearing my voice right now. Trust me. If you heard my voice about 8:30, 9 o'clock this morning, you would go, why the heck am I even doing a video today? My post-nasal drip on top of whatever this thing is was just absolutely insane. Well, let's continue on. So this morning, as I just stated, my post-nasal drip was absolutely insane, but last night the coughing fits, they occurred all night long, breathing difficulty, and this went on most of the night. I couldn't finally fall asleep until sometime after 4 o'clock in the morning. I know, scary, concerning, right? Well, fast forward, I ended up going to the urgent care. About 11:30 this morning, my dad took me to the urgent care. It's not too far away from here, over in Jenkintown, Pennsylvania. And I figured, we've had good success with them. My parents have used them before. I said, I'll go to this one, give it a try. I get there, right off the bat, they tell me, well, if you need to get tested, we don't have testing right now. I'm going, okay. But we can see you. I mean, we can see you and take you in the back, and the physician can come and see you. I'm like, okay, great. So the physician examined me. They saw me there. At that time, my blood pulse oxy level, O2 level, was 97, and then it actually went to 99. But they did witness me coughing. I was coughing at the time. They said, oh, yeah, there's definitely something going on there. So the physician then comes in, asks me a bunch of questions. I tell what's going on. She says, do you have mucus? Sometimes there's mucus. Sometimes there's not mucus. Sometimes it's a dry cough. It's a mixture. So she's saying, interesting. And she listens to my lungs. And then after she listens to my lungs, she says, okay, I'm going to recommend that you get a chest x-ray. However, we can't do that here. I'm going, this is interesting. We have to send you to one of our other locations over in Dresher, Pennsylvania, it's about 10 minutes away from there. No big deal. So I go out to the office. They schedule the other appointment, and I learned a couple things. I like to engage. I like to ask questions. I said, interesting. No chest x-ray. She says, oh, yeah. Our chest x-ray person quit on us. I'm going, oh, okay. First thought that goes to my mind, they probably got burned out from the volume of patients. And then I say to him, have you been busy with the respiratory virus levels being really high right now? He says, strange you should ask. Everyone keeps saying everyone knows someone that's sick, but really, we're not as busy right now as it was at the start of the pandemic. Yes, we're busy right now, but I've been working at urgent cares for many, many years. This is normal to us. This is what it normally is. But yet everyone says everyone is sick. In my head, next thought I go, well, you have to understand something. Not as many people often opt to go to urgent care because if they go to a medical facility or something, they may get a doctor's note or a positive COVID test. And if they get a positive COVID test, sometimes, oh, well, this just ruined the birthday party we just had. Oh, now I can't go to work tomorrow. They're going to give me a doctor's note that's saying I can't go to work. I can't afford to be off work. We have bills to pay. We have kids to raise. I mean, this is the way things are right now. And I'm not saying this making up these stories. This is real stuff. This is what happens. Read the posts that you see on social media. Watch some news stories. I have seen some news stories where people actually say on camera, I don't have time to be sick, and if I am sick, I can't take off. The bills don't stop coming in. It's the God's honest truth. It's what's happening right now. So let's fast forward. Enough with this nonsense. Getting back to my story. They gave me the script. They called the other place, went over to the chest x-ray, took me right away, waited a while for the results. They said the results came up negative, and I'm actually going to share those results with you. Yes, we're actually going to go one step further, but here's me at the urgent care today. You may have saw this, what I tweeted out here today. I tweeted out my whole story as it happened. I live nowcast tweeted, and wow, this is getting a lot of attention. It's been viewed by 33.8 thousand people. That's fairly impressive. So we left the urgent care place. I let my dad go and get some groceries for me, and they were supposed to call me back with telling me what I was supposed to do. They never did, so I called them because I got a text message from CVS for some medicine, and they said, oh yeah, basically just taste the medicine. I'm negative for in my lungs, and take the medicine, and that should help me. So I did get this medicine here, and I believe it is called medicine. I think that's what it's called. Hope I'm saying that correctly. Sometimes these medicines I cannot pronounce correctly, but that's what it is. And here it is right here. You know what this looks like to me? I ripped the thing off so you can't see what it says, but the point is, you know what this looks like to me? You ever watch Dennis the Menace, the old Dennis the Menace, not the cartoon with Mr. Wilson? Martha, Martha, get my nerve medicine. I mean, that's what it looks like, Mr. Wilson's bottle of nerve medicine. Hey, I'm trying to humor myself out of the situation. So I took it earlier. Do you hear me coughing right now? No, it actually works. It's stopping the coughing. The true test, though, comes. What happens in the overnight hours? That's when this has been happening. I can be fine in the afternoon and evening. Then after 9 o'clock, hello, back it comes again. Fingers crossed. I'll definitely tweet out tomorrow, and I just wanted to share this with you. I have to. Here's my chest x-ray. They said negative. Now, I'm no expert, but I have seen what COVID chest x-rays look like and other types of things, back in the early days of the pandemic. Here's my chest x-ray, and it does look clear to me. I put it side by side to other chest x-rays. If anyone is a medical expert in form of a doctor, let me know down in the comments down below. Do you see anything that looks concerning to you? If you do, let me know down below. And they gave me a copy of it as well, and I am going to take that with me when I go to my pulmonologist appointment on Wednesday. Hopefully I'm going to be able to go. I don't think I'm going to be able to get my injection of Exolar on Tuesday because I'm now on this medicine, but I will find out that answer on Monday. Moving on now, there is something that I want to show you in the Philadelphia Inquirer. Take a look here. And you may have heard about this the other day. I may have mentioned it the other day, but this was the Friday's edition of the Inquirer, and I'm glad to see that, hey, it made it on the front page. So there's one side of it. Here's the other side. It may be very hard for you to see, but right here, they talk about masking requirements are back at some area hospitals, and this is in the Philadelphia area. You'll need to cover up at Mainline Health and Cooper Health, which is over in New Jersey. Cooper Health is New Jersey. Mainline Health serves parts of Delaware County, Montgomery County, along the main line. And it's because of COVID and respiratory viruses. Cases have been increasing. And yes, we know that they are increasing, which is why they're bringing these mandates back. I call them safety precautions. But in the case of Mainline Health, it's only going to be for 2 weeks. I also learned today, aside from that, this is completely separate. Penn Medicine is talking about that they're going to be masking back up again and requiring all visitors to mask up again. So this is fantastic news that masking is coming back in healthcare, but can we be wise this time? Let's admit it. Viruses can happen all year round. You never know when the next new mystery virus is going to pop into your facility, and it could become a super spreading virus that causes a big problem and, goes worldwide like COVID did. You never know when that's going to happen. Please, this time, could we wisen up and just keep masking? These N95 masks in place throughout the year and every day of the year, at least in healthcare settings. I'm not calling that grocery stores, all these places, 24/7 masking. I'm not saying that. I'm not trying to put restrictions on your life. But it just makes sense to mask up in healthcare. If you're going to the emergency room, chances are you could be dealing with sick people. When I went to CVS today to pick up my prescription, which, yes, I had to go to CVS. I swear, we have the world's busiest CVS, or the city's busiest CVS. They had 3 registers going at the pharmacy, and there were still like 8 people in line in front of me. It's crazy, and of course, CVS, you have to get a tree, or you can opt out of it, although it didn't give me the option to opt out of my tree receipt today. That's another issue for another day. Pharmacies. That's another place. Come on. Pharmacies. People who are going to pick up prescriptions. Some of them could be sick. I went because I'm dealing with a virus. I picked up some sick medicine. Come on. It should just be a requirement to mask up in any medical setting at this point, especially in a virus season. If you're not going to do it all year round, okay, at least do it from the months of October through March. Is that much to ask for? Is it much to ask for? No, it's not. Because, again, the pandemic's not over. We rushed everything back, but yet there are so many unknowns, and that goes for any virus. Right now, my cold or respiratory, whatever it is, it's a mystery virus to me. I don't actually have a name for what it is. Alright, moving on. We have to talk about this. There was a surprise update on BioBot last night. Normally, I would just wait to show you this on Sunday. No, you need to see this now. They did a surprise update last night, and JN.1 is a very transmissible variant. I mean, it is super transmissible. So you see colors here. You see green. You see purple, you see pink, and then you see this golden yellow color, this mustard color. And that's the Northeast. Look what has happened in the Northeast states. Yes, you are seeing a huge explosion in wastewater on BioBot. It is now going up faster than, or equivalent to, BA.1. This JN.2 variant is the second largest wave since the start of the pandemic. So no, everything is not all fine and dandy right now. Everything is pretty bad at the moment. And the fact that, hey, this is the second biggest wave, that's huge. And I gotta add something. I don't have the tweet up on the screen, but this is something you must see because I retweeted. Chris Como has a program on News Nation. If you don't get cable, God bless Chris Como for tweeting this out. News Nation is the fastest growing news channel. It's better than the others, in my opinion. The point being made is this makes it even more great. He's going to start doing a series on his show on long COVID. Yes, he's going to talk about it. Why? Because he is currently dealing with long COVID. And in fact, can I actually pull that tweet up? I think I can. Let's see here. You have got to see this here. Yes, here it is, right here. Chris Como put, I have been struggling with a cold for over a month. It is hard to bounce back from illness more now due to, quote, long COVID. Have you experienced it? Dr. Lee answered many questions I had tonight, and we're going to be doing this as a series because I know a lot of you have reached out with your own experiences. I wish he would upload the long COVID series that he's going to do to YouTube or just continue tweeting it here because it is something that everyone needs to see. A lot of people don't understand it. And News Nation is they're a rapidly growing audience. It's getting bigger. So the fact that they are publicly doing this on their channel, this is huge. Finally, long COVID is going to get some attention, and I hope he stands with his word and does continue with his series that he's going to do on long COVID. Finally, because we need someone out there. And if he wants to, if someone can get a hold of Chris Como and tell him about my channel, by all means do so. I would love to go on there and tell my side of the story from a data perspective of what we are seeing going on out there. I would love to talk about this. So, anywho, just thought I would share that. And one last thing that I want to share with you, and that's it for today's pandemic update. I want to show you this with deaths. We have Missouri, we have New Jersey, and Massachusetts. Look at this orange here. That means that there are a substantial increase trend. It's a bad trend right now in the past week of increase in deaths. That's not good that we're starting to see these deaths go. Missouri, 65% increase. Then we come over to New Jersey. Looks like, again, 65% increase. Then we come over to Massachusetts, and it's an 87% increase in deaths. Now, they're not saying the actual number on there, but again, deaths up 87% from the prior week. So, yeah, they're starting to go up, and they're also moderately going up in places like Oklahoma, Kansas, Iowa, Minnesota, Wisconsin, Virginia, and Maryland. And remember, deaths are the last lagging indicator. So we suspect this map is going to fill in over time, probably as we head into mid-January and late January, where deaths will go up. We should get a new national deaths update from BNO tomorrow evening. Would not surprise me if it goes at or over 2,000 because the number last week was low and they said it was because of lag. Alrighty, folks, that does it for today's pandemic update. We'll have another one tomorrow with the wastewater. We may include some other data, and they're up real quickly. I forgot to add something. I have to mention New Jersey here. Hang on, we got to pull this up because this is very important. New Jersey and New York City. Yeah, they're close to each other. New York State, bellwether states. Well, New Jersey hospitalizations. 69 out of 70 hospitals reported today. And take a look at this. Yeah, their hospitalizations went up again on a weekend. That's not a good thing when they go up on a weekend. Sometimes they drop a little on the weekend, then continue up on the weekdays. So it's still going up on a weekend. That means no peak yet in New Jersey. Taking a look at ICUs, 147 in the ICU. Discharges, 278. That's quite a few. That means 278 discharges was not enough to overcome the admissions, which means, yeah, numbers are still rising. All right, that does it for today's update. We'll have the wastewater update tomorrow. If you like this video, give it a thumbs up. I know, it's a long one today. Subscribe if you learned anything today. I am full transparent. If I'm having a health issue of some sort, I share it with you. I even showed you my x-ray results. Who else would do that? Who else would give you an update on what's going on with the pandemic and also talk about their personal experiences with health? Not too many channels do that. So subscribe if you want to see more of that down below. Share with anyone who needs to see this. And by all means, stay safe. I will see you all again next time. Test negative and have a fantastic Saturday evening see you again tomorrow, which is Sunday. Thanks for watching.